All right, well, let's go ahead and start with a prayer. In the name of the Father, and the Son, and the Holy Spirit. Lord God, you are the giver of all good things, our creator and our healer, our redeemer. And so we thank you for how you have made the world wonderfully and how you have given us wisdom and insight into your wonders of creation, wonders of the human body, the genius of the human body, and invite us into your own healing power. So we thank you, Lord. We praise you for that. We ask you now to bless all who are here. We ask you to bless the St. Gianna Women's Health and Fertility Center initiative and all those who are a part of it and all those who will be a part of it and all those who will, we pray, benefit from these services. We ask you to help us to put forth a more holistic and Christian standard of care for this whole area and beyond. We put all this under the protection of the Blessed Mother, and we ask this through Christ our Lord.
Amen.
The Father, the Son, and the Holy Spirit. St. Gianna,
Pray for us.
All right. So I'm Father Dan. I'm the pastor here at Newman and at Sacred Heart in Columbia. And this is?
I'm Willie Shearon. I'm a medical student at Mizzou actually, and I'm a fourth year, so I will not know where I'm headed until next week for match day, but we're hoping to stay here.
We hope that you will stay here too. He and his wife and lovely daughter. How old is she?
She's almost 2.
2. All right. So just to give you a little bit of history, and we'll kind of just maybe trade off back and forth on things here. So the idea behind this evening's talk is, was it last month? Our last Genius of the Body talk was challenging the standard of care. So we had a panel discussion of medical professionals talking about how medicine is often practiced today, and how sometimes from a Catholic perspective at the very least, or just sometimes even from a human perspective, it feels like that doesn't quite match up to the dignity that is ours, and we want and long for something more, something different, something better. So this evening, we wanted to talk with you about kind of what we think is an alternative to that standard of care. And one example of that being the St. Gianna Women's Health and Fertility Center. So I'll just give a little bit of the kind of the history behind this idea, and then we'll start talking about the development of it, practically speaking, where that stands now. Sound all right? So it's probably been maybe 3 years ago now. We had, here at Newman, we had Leah Jacobson come and give a talk to mostly our college students, some others as well were there, on holistic feminism. She had written a book called Holistic Feminism, and I had never heard of her before. She used to be the campus ministry director at the Newman Center in Duluth, Minnesota. She and her husband and her growing family, and she said when she had left that job and was moving out, Father Mike Schmitz was moving in, so he took over from her. So, but she founded an organization called the Guiding Star Project. Thank you, Phyllis. The Guiding Star Project, which is striving to start women's health centers around the country. I think like a year or two ago, they had about 8 or 9 of those established. And when I talked with, I ran into Leah at the Seek conference a couple years ago, and after her talk here, and she was telling me about these health centers that they were opening. I said, oh, you need to bring one to Missouri, because she had a goal of getting one in every state. And she said, yeah, I was thinking about St. Louis being a good market. I said, no, Columbia. Columbia. St. Louis has a lot of good stuff, because here in Columbia and the Jefferson City Diocese, a lot of times if a woman is having fertility issues, we send them to St. Louis, because that's the closest place to really get good care in that regard. So we started to have a conversation about bringing one of her guiding star centers here. And by that point, they were kind of in the process of kind of a whole reevaluation of their mission and purpose. They really were starting to focus more on their centers as birth centers, you know, to kind of show forth the superpower, so to speak, of the female, and, you know, being able, and this, you can give birth, and, you know, this is something that you can do. You don't have to have a whole lot of medicine or intervention necessarily. I mean, sometimes that's necessary as well, but let's let you do this yourself when that's possible. So we start, while they were kind of in their reevaluation process, we said, well, let's not wait, let's go ahead and move forward ourselves. And so we put together a committee and hired a consultant to kind of guide us through this. And so Willie agreed to be one of the members of this business planning committee, we called it, and several other people. Christina Vollrath, she's the president of the Columbia Nursing College, I think. She was supposed to be here. She had another meeting come up, so she hopes to arrive a little bit later on when her meeting finishes. But a couple of OB gynecologists and nurses and, you know, different medical professionals are part of this team, and me. So over the course of thinking about this, we've kind of decided that there is a need for this. Like, our consultant did some research on that and said there's a growing desire in this country and worldwide for a more holistic and more natural approaches to healthcare. And one of the things that we kind of decided would be our kind of a unique like niche or unique offering is what's called NAPRO technology, natural procreative technology. And that's kind of an umbrella term for NFP, natural family planning. It's you know, there's a lot of growing body of knowledge about the woman's body and the amazing complexity and beauty, and cooperating with that instead of just trying to control it by pharmaceuticals or other means. So we decided that would be kind of our main unique product, but also just offering regular, normal gynecological services from kind of a more of a Catholic or Christian or dignity perspective. So one of the big things being that sometimes the standard of care says, you know, doctors are under a lot of pressure to see as many patients as they can, you know, to make the profit margin. And so, you know, a doctor might kind of be under some pressure to see a patient for no more than 15 minutes and move on. And there's some study that says, on average, when the woman starts to talk about her particular issues, they're interrupted after about 11 seconds. So we really want this to be a model of care that says, no, we want to do like a full interview, give you plenty of time to tell your story, and not just treat symptoms, but look at root causes and what's kind of your history here, holistic history, you know, and then try to get at what are the best ways to treat that. So I'll let Willie talk for a little bit. I've been going on for a bit.
I'm not quite sure what else to add. That's a very good summary of what we're doing. At this point, we're in the process of, I think we're setting up a 501c3 organization, and we're formally working with the Diocese of Jefferson City to establish the kind of chain of command leadership structure. And at that point, we're going to be excited to start some more planning that can only happen after that point. We're looking around the city of Columbia for some real estate. Maybe we're going to rent to own. I think that's the leading idea right now. But we're going to be hoping to open these doors either later in 2025 or later, maybe in the first half of 2026. I think that's our goal. So lot of work to be done in the background. It might not appear like there's anything going on at the moment, but there are plenty of people working, I would say, harder than I am on this project. Father Dan's vision on this has really been inspiring. There are many women out there who I realize the irony of having two men up here right now, but there are many women who I know would very much pursue this sort of opportunity as a patient. So it's a wonderful way to apply our faith to a current situation, which I'm enjoying.
Amanda?
What do you envision the staff to look like in terms of doctors, nurses, so on and so forth?
So I'll just repeat the question for the live streamers is what do we envision the kind of the staff makeup for this the St. Gianna Center in terms of doctors, nurses, etc. Do you want to go first at that?
I could try. I think there's going to be 2 or 3 physicians, and then there'll be, we don't have specifics on nurses, but I think there'll be a CFO, and they'll be kind of overseeing the whole clinic. We have a CEO. We've got to determine all the specifics regarding compensation and which exact services will be offered and how much those will be charged. Something we've discussed so far is the insurance, handling the insurance of those billing situations, because a lot of these practices are not covered by, even if you have insurance, they're not often covered by insurance companies already. So we've discussed the possibility of just charging cash to minimize the overhead and keep offering as much as we can for cheap. A lot of the centers, there's a few in St. Louis, others around the country that do similar models, so we've been learning from them as we've spoken to them in the process. A lot of these details have yet to be fleshed out fully, but those are some of the generals that I speak comfortably about.
Yeah, so we're hoping at the very minimum to start off with 2 like OB gynecologists, like a nurse practitioner, a couple other nurses. There'd have to be like an office manager, a receptionist or 2, probably 2, so that they can take some days off once in a while. We'd have to figure out the finances, like who would be like kind of the bookkeeper or billings person, etc. So part of what Willie was saying, if we are avoiding insurance, which kind of frees you then a little bit, both in terms of expenses, but also in terms of the insurance kind of saying, dictating how indirectly at least, the kind of care that you're providing. So kind of we don't want to turn anyone away. That's kind of the Catholic model of healthcare, right? That everyone, the rule of St. Benedict, receive everyone as Christ. But so there would be kind of a sliding scale of fees that would be off, for services rendered. But then we would also provide, like if you have insurance, here's the code that you would use to contact your insurance company to try to get reimbursed yourself for what you pay us or whatever you can get from them. So it sounds really good, and I hope that would pan out well. As Willie mentioned, we'd have, so if we're a 501c3, that would also involve having a board of directors, and we want it to be under the oversight of the diocese, of the bishop of this diocese, so that would involve, in the bylaws that govern that, there would be stipulated somewhere that the bishop is the one who appoints the members of the board, for example. The details of that have to be worked out. So he wouldn't be a member of the board himself necessarily, but he would have some control in terms of who gets on the board. So that we want to be under that kind of oversight, because it'd be really easy to get started with a great vision, high ideas, and then just over time, the society kind of pulls you into a different vision, or the finances pull you into a different vision. So we want to have something to kind of pull us back and hold us steady at the same time.
Okay, so you've talked about sort of reproductive care and OBGYN services. Are you envisioning anything broader than that? Would this be an alternative to primary care, potentially, for women?
Go ahead.
At this point, I don't think so. You know, there's a whole range of gynecological services, and that would go as far as like pre and post menopausal care as well. And in, you know, like some pregnancy care, but not birth care, at least initially. So, I mean, primary in terms of your like fertility care kind of
Okay.
vision there. And a big part of this would be education. So like when I mentioned like NFP, there'd be a lot of teaching for that. So we would, in our visioning for the venue, the place where this would be, we really want to have like a conference room where we could bring in groups, like grade school groups, high school groups, college groups, you know, parish groups, you know, whatever kind of groups. And even, we talked about this at one of our meetings recently, like having some staff that could go out and do same kind of workshop or seminar in outlying areas as well. Go into this town or this parish and present. Because we really hope that this would be something that would draw people in, not just from Columbia, but from the larger area. I mean, think about how large an area the university or Boone services. It stretches out into the rural areas, you know, 50, 70 miles easily. People will drive that far before they go to St. Louis. So we want to have that same kind of coverage and range as well. And that's one way to go out and like go to the grade schools and present a little genius of the body, you know, for the girls and boys, and their parents then learn about it as well. And then maybe they grow up saying, oh, there's this great place in Columbia, I need to go there.
You see the center as sort of like this hub for fertility care, you know, like a fertility care practitioner is like, that's like where they are, it's like their headquarters, and they kind of go out from there, like, because I know like Phyllis is great, she doesn't have like a space, you know, she kind of goes, but like, wait, you can go there, you know, like people, you walk in and meet people, and cause I know not everybody's a physician, but anyway, I think.
Yeah, we do
great.
really envision it as a fertility hub, so to speak. That's the word that you used, I think, phrase. So yeah, for people to, you know, who have just normal health fertility care, but also if there's issues going on, like we've talked specifically about like endometriosis is a very common fertility issue that women have, or polycystic ovarian syndrome, or you could probably name some others. Or you can probably name some others as well. You know, part of the vision is, gosh, if this really goes well, we would love to have our services expand. So I mentioned, you know, like potentially, you know, having birth suites as well, but I would love for this to become like a surgical center as well. Like we've had here in our Genius of the Body series, we brought in Dr. Kristen Kalinowski from the Veritas Clinic in St. Louis, and they are entirely focused on surgeries, and they have some kind of cutting-edge ways of doing surgeries that really are helpful for women struggling with endometriosis, polycystic ovarian, etc. So I would love to see that kind of care, not just in St. Louis, but also here. And it's probably good, and maybe you want to mention, we don't want this to be just a Catholic thing either.
Yeah, it's not about finances, you will not be turned away for your religious background as well. But the goal here is just so many times you go to the doctor, I don't speak about this as firsthand experience, but it comes as a shock that you might be offered a medication that you have never even thought about taking, but it's recommended by everyone for some reason. So a lot of the times we're hoping to turn these sorts of encounters into a positive, like Father Dan mentioned, dignity-focused moment, regardless of faith background, and aligning our actions with our faith, which is difficult to do in the medical setting. So really being fundamentally sure of our reasoning and being able to articulate that is really the basis of welcoming people in. Obviously, open door for people who are interested, and that The specifics, of course, will become clearer with time, but I hope that serves as in the meantime.
And maybe, if you don't mind, maybe you can just share with us a little bit of your own kind of background, you know, you and your wife both, why you have such a kind of a passion for this, interest in this, what has been your experience there?
Absolutely. Yeah, so Kristen Kalinowski in St. Louis, she's the surgeon at Veritas. We were with, my wife and I had to travel to St. Louis to see the previous surgeon at the center. His name is Patrick Young. You may have heard that name before. Both very Catholic-oriented surgeons who seek to treat fertility in the operating room and to maximize fertility in a Catholic way. He was the one who got us all in the Creighton model for charting for NFP reasons. And he sits you down when he's meeting with you in the office, and he has you go through your chart with him because he's very well acquainted with that whole system. So that whole piece is another factor. We're going to talk about education. I think charting is probably, if we're talking about what would be available on day one of this center, something where it's straightforward enough and low cost enough, quite frankly, to just be teaching people how to chart, teaching women how to chart. That could be married couples, that could be single women, that could be high schoolers, whatever. But the actual experience at Veritas was really wonderful. We had a great experience with Dr. Young, and almost instantly we were fortunate to be blessed with our daughters soon after that. So that was a wonderful cherry on top. But obviously there's only so much that a surgeon can provide, but really the faith experience of praying with our surgeon before surgery and all those kinds of things was really inspiring. And that's the kind of thing that I know people drive for, we drove for. So we'd love to create that somewhere a little bit more locally.
Willie, could you speak more to like the honoring of the dignity of the medical professionals, like how, like you or others that you talk to that would be excited to work in a place like this?
Yeah, I'm sorry, Joe. Could you just describe for me a little bit better? I'm not sure I understand the question.
Could you describe like sort of why like you or someone like in the medical profession would want or hope to work in a place like this?
Okay.
Like honoring the dignity of the medical professionals too.
Okay.
Like, and how that's different or
Yeah, the question.
yeah.
Yes, the question is about how we encourage or how we might see professionals who are interested in working in this setting. What kind of decisions they may make to be there.
Or why they would want to be there and maybe not in other places. Or,
Okay,
yeah.
the draw for a professional to work in this clinic versus something else perhaps. And I think a lot of it, Father Dan just mentioned under his breath to me. He said conscience, that's the first priority I would say. A lot of these professionals that you'll encounter in secular medicine are of course of the belief that they are acting in a conscientious based way. But every act is either good or evil, and we're hoping to maximize our good acts, I suppose. If I were to speak about moral theology any longer, you'll realize I know nothing.
Doing great.
But we're just trying to align our practices with our beliefs. And the chance to work in OBGYN, honestly, I think many of them are driven by the excitement around childbirth, but the kind of slippery spots from a moral standpoint can easily work their way into anyone's practice daily. So creating a center focused on this, I think it would be a wonderful outlet for someone who's maybe not quite sure that certain medications or procedures are to the benefit of the patient. And I think evidence shows that, but we will have to see how well we can send that message to other professionals.
In terms of like the fertility care, would you guys provide services to like test the health of a person, like of an individual?
Yeah, so the question is, would in terms of fertility care, would this center actually be providing tests to people who come in to help them to know what, you know, what their state of fertility is, you know? I think a lot of times what would be happening is, you know, like a married couple, or like we're trying to get pregnant and we're not having any luck, you know, and so they come to the center and say, you know, can you help us figure out what's going on, you know, or maybe not. Maybe it's just someone that just says, you know, maybe I'm single and I want to know more about my fertility. You know, do I have healthy fertility? Because that's one of the things, you know, as Willie said, we're both men, but in attending these Genius of the Body talks over the last couple of years, I mean, I've learned so much about, Phyllis laughs, she has taught me so much about the woman's body. We hear over and over again about, charting that the woman's cycle is her 6th vital sign. And there's so many things that you can learn about what's right or maybe off by keeping track of your own fertility cycle, your menstrual cycle. And as opposed to, I mean, the standard of care is often just, as soon as you start to go through puberty, here's some contraceptive pills, especially if you have, a hard menstrual cycle or heavy bleeding or, a lot of cramps or whatever that might be going on. Well, here, this will take care of that, instead of like, well, let's see if there's other ways, more natural ways, holistic ways that we can treat that, rather than potentially damaging your long-term fertility with, just walloping your body, as Amanda has said in talks, walloping your body with artificial hormones. So, we all have, I think, or a number of us anyway, have had stories or I've heard stories rather, where, like, for example, and I've shared this with a number of people, but like one example is someone who, he and his wife were expecting their 2nd baby. They're very excited, and they go to see their doctor just on a regular appointment, and his wife is having, a few issues, like some preeclampsia and things, which, not to make light of that, but the doctor, just without hesitation, says, well, as soon as you have this baby, you need to go on the pill, and you need to have a vasectomy. And so then this guy is talking to me, Father, do I need to have a vasectomy? No. You're perfectly healthy, and your wife had some issues, but those can be dealt with, in healthy ways, in holistic ways, in other ways. And so often, a couple who are pregnant, the woman goes in and has her baby, this beautiful moment of joy. And while she's there in the hospital, they're coming in and giving her, free contraceptives and literature on how to, it's important to take these. It's like, well, just let her enjoy her baby here for a moment. Or when someone comes in, expecting their 2nd or 3rd or 4th child, God forbid, like, there's just this panic almost sometimes in the medical folks that say, something's not clicking with you, why do you keep having babies?
I remember at my wife's 6-week appointment, postpartum, or maybe it was sooner than that, I don't remember. But the so-called standard of care is to make sure you're on contraception immediately after your pregnancy, so that you, again, I fail to understand the logic, but I suppose it's at a higher risk if you were to get pregnant sooner after you had your last baby. But again, well-intentioned, but then she says, well, we're doing NFP, we're not interested in contraception. I'll always remember the doctor I was with her, she said, well, I'll write the prescription anyway, wink at her in case, your big scary husband, I wish that were true, I wish I was more muscular, but big scary husband is, telling you to do this, telling you to answer this way, and you can kind of do this on your own. And of course, they see the worst of it all, I understand, and there are big scary people out there, but I will always remember the shock of, oh, you just told me this, and I'm going to go directly against it anyway, and make it a little bit more uncomfortable. So some of those interactions have really inspired me to continue down this path with this whole project as well.
I was hoping, Willie, if you could continue kind of on that line of speaking to how this clinic that we're hoping to get up and running will help support the dignity of the couple together. So it's not just, the woman by herself, but also taking, the husband in, if it's a married couple, that bringing the husband into the conversation and making it a moment with the couple, not just the woman by herself, that she is supported by her husband. Does that make sense?
It does. Yeah. The question was about how we might hope to focus our dignity on the man and the woman in the couple, and to maintain that going forward. And it's hard to do that in an OBGYN setting. I'm not quite sure what I should say here. But a lot of it is just about the language and speaking about what is normal and what is expected. We hear a lot about, at least in school, we hear a lot about, it's all about the woman, it's all about the woman, it's all about the woman. And that's true to a certain degree. And what's lost in all of that, as we can all imagine, is the voice of the family. This is meant to be a pro-family, pro-woman, pro-man, pro-science center. This is not meant to be exclusionary in any of those senses. Even if you're not Catholic, even if you're not Christian, even if you cannot pay, this is the picture of inclusion. And it is not inclusion in name only. This is where we will actively welcome anyone who is willing to come to our door. And that starts at the family. So we will be empowering families for as long as it will exist.
Willie mentioned we hope, we plan and have every intention for this to be pro-science. The church is very much, follow the truth wherever that leads you. The truth is not incompatible with faith. Absolutely not. Jesus said, I am the way, the truth, and the life. So one of the things that we really believe will be a foundation for this center as well is we will have the medical professionals that are there not only will be trained in NAPRO technology, natural family planning, but also, what goes hand in hand with that is being very familiar with how the hormones work, and ways to kind of help a woman, or potentially a man too, to regulate or deal with those hormonal issues. And there's, what's her name, the hormone genius? Teresa Kenny. She gave a talk here last year, a year and a half ago, for our Genius of the Body series. She works for the Sacra Familia Institute in Omaha. And she and another lady, Jamie Rathkin, together they have the Hormone Genius podcast. I have not listened to that, but I recommend it to others all the time. But it's that kind of a thing that I hope this center can also be a center for the to advocate for the hormone genius as well. To really, some of the, and you might be able to speak to this. Sometimes I talk with some of our medical students, and they feel like their education has kind of not gone into that as deeply as they would like, or it's more kind of like pharmaceutically regulating hormones instead of understanding more deeply how they work and other ways to treat them.
Yeah, it's NFP is mentioned in lecture. There's laughing. It's always the wrong answer on the test. It's all that kind of stuff. But Father Dan's answer there reminded me that another thing about giving the contraception after the birth of the child is just insisting that you are unable to control your own sexual urges, and you must take this medication because we are going to assume that you will not be able to do that. And that's just so depressing. It's just a depressing way to view people, and instead of building them up and encouraging them on an ideal standard to maintain their health while also respecting their ability to make their own choices, we're just going to say, a lot of times you hear doctors just say, we're going to do this because we assume that they don't know any better, basically. And it's really quite aggravating to hear that over and over and over. I've grown numb to that, I would say. So it's saying it out loud is reminding me that I feel this way. But a lot of times it's, we're going to do this because they can't do it on their own. So this is another way to empower those couples, those families that we've talked about.
Can you just speak a little bit to, I know we've kind of talked about how, what the center's not going to do postpartum, but maybe what they would do postpartum that would be different?
Daycare. I think there will be daycare at the clinic.
We would hope so, yeah.
Yeah, we're planning on it. There will be education for all of your postpartum needs. There will be lactation discussions.
Yes, thank you.
There will be all kinds of preventative exams that can be done, or checkups as well. Whether that's routine or postpartum is, I suppose, for debate. But there is going to be a renewed focus on the whole lifespan of the family and making sure that There's a chapel nearby. We hope to have a chapel in the center as well.
Great.
We'll see how the real estate works out. But these are just the kind of ways that we're incorporating those sorts of beliefs into the planning stages at least.
Some other services that we had talked about that we haven't mentioned so far is we want to have a nutrition specialist be there as well, because, you know, the literature just says over and over again that has a huge impact on health, eating the right things, getting the right balance. So to have someone there to help with that. We also hope to have someone available at the center to provide counseling services, you know, because again, if you're going to treat the person holistically, they're not just matter, they're not just a body, they're also a mind and heart and soul. And so we want to treat the whole person. So we want to have services that are going to be available for the whole person: spiritual care, you know, emotional care, mental care, nutrition, etc. Yeah, I'm glad you mentioned we plan to have lactation consultation and services as well.
This is sounding more and more like a child of the Pope Paul VI Institute, or St. Paul VI Institute in Omaha. Working with the couple, teaching the couple together about their charting in terms of what's your basic fertility. That's where you're going to start with diagnosing and treating. And the husband is included all along the way. And there's a chapel and ongoing research. Dr. Hilgers never stops. So, yeah. And that's, of course, where the name neprotechnology came from. Those are medical applications for the create and model fertility care system, which is the system of recognizing fertility and infertility, et cetera, et cetera.
One of the things too that we haven't mentioned is that in terms of the where we see a need for this as well is just in demand. Like some of the research that we have been shown anyway says that in this area it's not unusual for a woman who wants to get an appointment with an OB-GYN to be, you know, like there's a 6-month waiting list maybe. And so the center might be seen by some of the other healthcare centers here in Columbia as being competition. But at the same time, it's like there's a need, I think, just in terms of services, being able to provide services to women who don't want to wait 6 months or longer to get an appointment. So we plan to start off with at least 2 OB-GYNs, but we really kind of believe that we might be having to hire more quickly thereafter.
Yeah, another thing about that is, on an anecdotal level, you might hear about women who have, you know, they just drink goat milk, they eat kale for lunch, they are very health oriented. A lot of suburban moms on this AHA thing is kind of taken the world by storm. A lot of renewed focus on health and daily practices, but they also, someone might take a pharmaceutical as well to regulate their hormonal cycle. And for what it's worth, I've just seen a lot of evidence that there is a renewed focus on shifting away from that for secular reasons, not even just for religious reasons. So we're hoping that we can bring a large swath of women back into kind of focusing on how their body operates optimally, and this could, God willing, bring more women into the church, more families into the church. This could be a wonderfully positive venture in that regard.
Yeah, we really kind of see this could be a real culture-changing thing for this area. You know, I mean, just think if there's a large number of the females from middle school through college and beyond who start becoming familiar with how their body works and letting their body work as it was designed to work, and then because of that knowledge becoming empowered when they go in for it, like let's say maybe they go to another doctor, not to the St. Gianna Center, being empowered to say, you know, when they're being said, this is what the care I want to give you, to say, no, I don't want that care, I want this kind of care. Because we hear that a lot, you know, there's a lot, you know, you have to be kind of proactive in taking responsibility for your own health care. You know, and sometimes, especially in the past, but still today, for sure, we go into the doctor and whatever the doctor says is, we accept. And that, I mean, I probably would be in the same boat there. But it's good to ask questions at the very least, and to feel empowered to be able to say, well, no, this is what my body is telling me. You're not listening to me, you know?
So would you foresee working, or you've been working in cooperation with a birthing center here in Columbia for the actual deliveries and that kind of thing at first, or how would that work?
So the question is whether we see ourselves working in collaboration with a birthing center in this area. There was, when we first kind of started this, we did a little bit of research to see what was out there, and there's not a whole lot, to be honest with you. There was one or two that we found, but I'm not sure if they're all still open today even. But so for now, we want to have a good working relationship with University Hospital, with Boone Hospital, because, you know, like if we're doing whatever, I mean, there might be emergencies that are beyond us that we need to refer, so we want to have a good relationship with them to be able to do that. So it's including, I mean, until we get our own kind of birth suites established, hopefully down the road, we would need, like if we're doing pregnancy care for women, we would need to have a good relationship with the hospital to say, okay, now we're gonna hopefully smoothly hand you over there, and we can prep them to say, this is what you wanna ask them for when you get over there. We talk to them about when you get there. Hopefully we can prepare them in that regard, but yeah, we wanna have a healthy relationship, even if we disagree with some of their practices.
On that note, would it be possible that your physicians would have hospital privileges at either one of the hospitals?
That would be great. I mean, that would be helpful, I suppose, to be mutually recognized in that regard. I mean, because wouldn't that be great if the University Hospital or Boone Hospital is referring people to us as well? Like, oh, well, there's someone over there who's really good at this, and I see that, and so why don't you check that out? So, yeah, we would love to have that. We don't want it to be an adversative or, difficult relationship. I mean, maybe there'll be some competition but that doesn't have to be an angry competition. It can be, let's let that spur us on to greatness.
What sort of post-menopausal care do you think will be offered?
The question was, what kind of postmenopausal care will be offered? I think a lot of it's going to be, we've talked about which exactly, there's some debate in the group about supplementation of, what is considered to be ethically sound supplementation versus not. And that's obviously more of a discussion for menopausal time of life. But in the meantime, I think there will be a big focus on socializing with other women kind of in the same area, same time of life. Just like there will be conference rooms used for high schoolers or grade schoolers. We hope to have some sort of menopause awareness, menopause kind of care discussions, and that it's basically like a multi-purpose room. But if we were to have those sorts of meetings with women, we hope to kind of just, I don't want to speak too far past the end of my nose here, but I do think that's an ongoing discussion, and I hope to have more specifics going forward. Maybe Father Dan has something off the top of his head.
Not too much, really. Like Willie said, there's some more research that we would need to do on what's out there. Like there's a pellet, there's hormone pellets or something like that. Is that what it's called? And supplements that are biomarkers. No, what's it called? Bioidentical hormone therapy. So we're open to that, but we feel like we need to do a little more research into that to make sure that what we offer is not just morally sound, but really good for the body, which would be, those two go hand in hand. So that would be one way that we would hope to be like there's some in our committee who have said, gosh, having some kind of supplemental therapy like that, or treatment like that, just makes a huge difference for someone who's going through menopause. So we need to take that seriously, and we want to look to that.
What about perimenopause? Will that be included as well? Okay.
A lot of discussions about bone density, kind of maintaining those sorts of tests and ordering the treatments as appropriate. We talk about regular preventative exams, so that's beyond necessarily the fertility lifespan, but maybe just regular pap smears and treatments as appropriate. I think we've even discussed STD concerns as well. Those are obviously a little bit more, expected to be a little bit more of a minor issue at our clinic, but that's certainly something we've discussed. So there's a lot of voices going into that discussion about what exactly that will look like, but we could have a more formal list in the future.
Dr. Kalinowski
Sounds good.
would be a good source for picking her brain for that. Because I'm sure she's got a lot of that in her training.
Teresa Kenny has a lot about that, like perimenopause, menopause. I've listened to some of her podcast episodes on that. They're very good.
Yeah, there's a growing, Phyllis mentioned there's like at the St. Paul VI Institute in Omaha that does a lot of medical research, and so there's a growing body of that, and that would be great as well if this center could add to that, by tracking some of the cases that we work with here and adding those to the body of knowledge.
I'd just like to clarify, I mentioned STD testing, and I got some funny looks, and I think that's fair. I think part of this is driven towards meeting people where they are. We're talking about meeting people who are not of this background that we all might be. And by treating these people without that judgment, with the dignity that we're talking about, I think it could be, again, we've all talked about the dignity that comes with treating someone like that in that situation. So I don't want anyone to get the sense that this is somehow shifting off topic, but it is something that I think a reasonable person would be aware of, at least in the moments when you're meeting someone for the first time. So.
Yeah, I think we have to treat the person that comes to us for help. We're not going to, our purpose is not to turn anyone away. We might have to say, like if someone comes to us and says, I want this, and it's like, well, that's against our moral principles, we can say, well, you can go to another center or clinic or hospital to request that, but we can't provide that for you here. We can tell you why if you want to listen to that, but we want to deal with everybody, not turn anyone away. And so if someone comes to us with STDs, we'll help them, we'll treat that, or would be the plan. Hopefully we might also be able to have a conversation in the course of that to say, are there other healthier ways to live your sexuality that can help you to avoid these things in the future? Not just physically, but mentally and emotionally, spiritually. Again, treating the whole person.
A lot of impacts for baby in that situation as well.
Yeah.
What are some ways parishioners or interested parties could show support for the development of the clinic now? Like maybe financially, but also, are there any other ways we could help out?
That's a great question, Brooke. I'm glad you asked that. So the question is, how can parishioners or others get involved or help or support this vision here that we're trying to do? So, St. Thomas More Newman Center Parish here, we have every year we have Lenten giving, projects that we specifically ask people to consider this project or that project as Lenten giving. And this year, the St. Gianna Center is our Lenten project, and so certainly, there's gonna be a lot of funding that we'll need to get started, so Willie referred to this, but kind of the timeline of where we are right now is we're trying to refine some financial numbers in terms of, you know, what we envision salaries and benefits and all those costs to be, putting an actual number to the services that we intend to offer. And so kind of trying to put together all that to show the diocese, for example, and us, that this will actually be sustainable, you know, that we can actually make this work. So once we get those together, we'll give those to the diocesan CFO, and then hopefully he'll make a positive recommendation to the bishop, and then the bishop will say, this is wonderful, you have my support and approval going forward, at which point we would apply for the 501c3 status and get our bylaws and board set up. And once we have that in place, then ideally, in my little head, we would get approval from the diocese or someone for a loan, a substantial loan, that we could use to start hiring and to rent the venue and to kind of get started. And then we could open our doors even quicker. Otherwise, if we can't do that, we'll be doing a lot of fundraising to the point to where we can do that then. So we'd love to fundraise, you know, a startup of I think we talked about it, around 2 million, 1.5 to 2 million startup. And then that would really sustain us for any ups and downs as we get started over the first couple years, 2-3 years. So we'll be looking to, in the next year, hopefully less in the next 6 months, to hire nurses, doctors, you know, office managers, etc., a CEO. So would love for people to pray for us, you know, for God just to clear away any obstacles. Would love for people to support us financially. You know, if there's someone out there who is really good with medical finances, to give us some advice there. We kind of are in need of that right now. We have a lot of medical professionals and a priest, but not a lot of medical financial expertise right now. So like if someone was a medical CFO, chief financial officer somewhere, who'd be willing to help us, that would be awesome. So those kind of things. I don't know if you want to add anything. Okay. Yeah. Someone wants to gift us $5 million. That would be awesome. Or just 2.
Or just 2. Even 1.
One would be a great start.
So if you're able to get it open at the end of the year, which is kind of the earlier side of things, what do you envision this opening to initially be like in its smaller state, I guess?
We can talk about that a little bit, and I'll need some help in a second. A lot of education, a lot of, we've talked about traveling out to those parishes or satellite locations. The question was what we might expect the day one of the center to look like after opening. A lot of education, a lot of meetings in the conference room, welcoming groups who want to learn more, getting people in the door is really the focus. There will be some, I think perimenopausal is probably one of the larger areas that we hope to find people willing to come to our center, because there's going to be some preventative exams that are done. There's going to be some procedures that we could offer for if you have, for example, an abnormal pap smear or something. Some of those can be done in the office, so those are things that we can handle by ourselves. But from then, it's going to rely on finding young women, married couples, anyone expecting a child to be welcomed into our doors and to be started if you're going to have a baby, starting down that pathway of being seen regularly and being checked up on by our staff, with the hopes that you could go to Boone, or we have to negotiate or discuss those relationships with Boone and the university. But I think the first step is gonna be the education, teaching people how to chart, perimenopausal, I would imagine, is one of the first few as well.
We did about a year ago now, we did a survey that went out to all the parishes within a 50-mile plus radius of Columbia. And we got a pretty good response rate from that. I forget exactly the number of responses, but there was a lot more of kind of there was a whole age range, because we asked for ages of those who were responding. But there was probably a majority of the women that responded were in that peri or postmenopausal age range. But there was a strong interest from them as well. You know, of all that responded, there was a strong interest in this. Like, you know, yes, we see a need for this. We want this. So we would, just going on that, we would also say that, yeah, I think there could be a lot of women coming in who are a little bit older saying, you know, help me to navigate menopause and my emotions and yeah, and then we would love to have a lot of education. So we would be reaching out to a lot of schools and beyond to you know, make contacts and get things going. Coming up here, I want to introduce to everybody another member of our planning committee for the St. Gianna Center is Christina Vollrath. So why don't you introduce yourself and tell them a little bit about what you do and your part on this committee.
Thank you. Sorry I was late. I was at another meeting. I am part of the business committee, leading the business committee for this work. I am a nurse by trade, so 30 plus years in healthcare leadership. ICU nurse, all the way up to healthcare leader. So my last several years have been executive leadership in women's health. So when one of my best friends reached out, Father Mertz had reached out to her about this project, I was very excited. Again, like women's health, and the topic, knowing it's faith-based, and kind of the initiatives we were hitting on, from fertility to menopause to all things in between, really kind of hit home personally. So super excited. I think there is a huge need here in Columbia. While we're saturated with healthcare, we also still have gaps. And I think we feel like we could, there's certainly a niche here that we could tap into. So we're very excited about the opportunities, and would love to, I think, hear from our community throughout this work. We're still very early on in the project. We've got a great team led by the best, but we certainly want to hear from our community, I think, which is why we're here. But feedback is welcome. We want to meet the needs of our community and beyond. So that's kind of my five-minute blurb. Am I covering?
Your job right now.
My job right now, I'm leading the business committee. So, personal job. Yeah, work for a job, yeah. So I am currently the chair at the nursing program at Columbia College. I was executive at Women's and Children's MU Healthcare for many years. So have been in healthcare leadership for a long time, and now in academia, and it's very different. So I'm learning a lot. When they asked me to take the job, I said, I have my doctorate. I know nothing about higher education. They assured me all I needed was to have my doctorate. So there we are. So I'm learning about academia daily in my everyday work. So it's been a great learning experience. But I do miss pieces, of course, of healthcare. So this committee has been great for me to kind of give back to healthcare and to kind of stay connected with the patients that I miss.
Any other questions? Please, for Christina. Do you want to, we kind of try to go through some of the services that the center will provide, but we probably didn't name all of them. Not that you can name all of them off the top of your head, but can you kind of go through some of the services that we hope to offer?
Yeah, I think when you think of women's health, really, in my mind, it's all encompassing, with the exception of OB at this time, right? Only because OB is a whole different beast, right? From regulations and ORs and you name it, right? The work that you have to do for OBs. We won't start delivering babies, but I think think that's where we would like to go. So it's education, right? It's educating our women and youth about the female body, about reproduction, about alternatives, right? Not going straight to what general medicine might preach today, right? So it's around contraception, it's around what does that look like, how can we do that differently, and faith-based. It's also then taking them all the way through menopause, right? I kind of mentioned a little bit, but menopause, there's a huge gap around fertility, menopause. I'm obviously well aware of that piece. I could talk a lot to that. There's a gap there, right? And while we have, I think, exceptional, this is never, we've talked a lot about this is not a dig by any of our healthcare clinicians across town. We have exceptional healthcare here in Columbia. We are blessed to be surrounded by exceptional physicians, hospitals, et cetera. So this is by no means to discount the work they're doing, but we hope that we can support them, kind of add in additional services. I know that two hospitals, two primary women's health hospitals, and they're both have a lot of patients, right? There's a lot of patients. There's a lot more patients than I think there necessarily are clinicians. So there's room for us in this space, and I think having just come from that, I think they will welcome us. I think that, of course, we would be competition, but I do think that there's a place, and I think we can show that we need them, like I think they might need us, right? We're gonna need a partnership, we're gonna need hospitals that we connect with, that we can transfer a patient if they come into us who's not doing well, right? How can we get them to a hospital quickly? How can we partner with X physician at X location? So we're gonna have to have strong partners, strong collaborations, and that looks like getting to know our colleagues across the healthcare arena, across both campuses, both hospitals. So we're super excited. We think that there's a lot of, like I said, from middle school, high school females on up. With the only thing we won't start off with really is OB, and that's just because of we want to get established, I think, first before we really kind of dig into that. That is, again, a whole different realm. I'm very excited about that piece because that is that's fun, of course. You know, having babies is fun, but it is a whole different ballgame. So, any particular questions about services? I could probably dig into. Should have brought my list in front of me, but
What about midwives? Is there a desire to kind of work and incorporate midwives? Are midwives in demand these days?
they are. We did talk about that a little bit.
I just repeat the question for the last.
Oh, sorry. The question was around midwives and if there's a demand and if we considered midwives. Yes, we have. I think at this point, because we weren't starting with OB, I think we thought physicians and nurse practitioners was kind of our first thought. Lactation support, of course, like that kind of general support. But yes, midwives, there's a demand there. I think through COVID especially, there was an increase in home births. We saw that on the hospital side. So there is certainly an interest. Columbia is a lot more urban and more, there's a lot more demand here in Columbia for those services, for that type of healthcare model. So I think we've talked about that. What could that look like? How do we support that? How do we serve that? How do we cover those patients? What does that collaboration look like with our physicians? So yeah, I think we're certainly thinking about that. They're not as easy to get. Having just come from a hospital side where we were hiring nurse midwives, there's not as many out there as you might think who want to practice in the hospital and or healthcare setting. Like a lot of them like to practice kind of independently too. So finding the right person who wants to collaborate with a physician. But I think we did briefly kind of talk about that, and I think the interest, I think, on the committee was certainly there. Yeah.
So kind of building on that, earlier we were talking about how it would be great if the OBGYN at the clinic at St. Gianna's would they have hospital admitting privileges and kind of establishing that relationship, what would be possible there. But I guess the midwives, is there a way that midwives go from seeing people in their homes to being able to come alongside a woman in the hospital? That could already be another established relationship, something that their hospitals are used to doing.
Yeah.
That could be another in to kind of help women
Absolutely.
kind of do things the way they want to do them and not feel pressure from.
Yeah, absolutely.
I'm just thinking out loud. That's already kind of something that happens.
Right, yeah, kind of repeating the question. There is certainly an opportunity for nurse midwives, at least in general medicine right now. I think, right, most of medicine tend to practice physicians, nurse practitioners, and getting nurse midwives, and there's still opportunity, at least a few years ago there was, right, in that a better, stronger collaboration. Certainly from home, bringing home and having the delivering home to the hospital, right? I know hospitals locally are hiring nurse midwives and hiring them as part of the team, but to have them deliver at home and or bring them in and have a stronger collaboration, I think there's still opportunity there.
I was just curious, because you have a different perspective since you've just joined us.
Yeah.
Can you speak to your experience with your patients in your practice? Why you think this care might be so needed or in demand?
Yeah, I think that there is a certain population who are looking for something outside of traditional medicine. And I think that is more prevalent, certainly here around Columbia. People who are challenging the status quo, right? It's not bad. I think it's great, actually, but it's different, right? It is different. There are some generations, probably myself included, right? When I had my babies, that it was whatever my physician told me, and I was not batting an eye about it, right? I would do exactly what I was told when I was told to do it. That also might be my birth order, whatever, right? But it was what you did, and that was back then, right? But I think now people are asking a lot more questions. They are, again, challenging the status quo, thinking of what else is out there, what's also out there that could be potentially more natural, be more all-inclusive, right? I know the healthcare teams are trying to also do that, right? And the work setting I just came from, they were trying to do more nurse midwives. They were trying to do more natural births in the hospital setting, right? So I think that the colleagues, the systems in town know that, and they're also trying to meet that demand. But they're in a hospital setting, right? Like they're in a hospital setting, surrounded by hospital politics and hospital protocols, and I think it's just they are bound by certain rules and regulations, frankly, that we might not yet be. Now, if we become a hospital where we're delivering babies, we're certainly going to have more regulations, of course, that are going to tie our hands a little bit too. But I think that watching that right now, there's a demand for what can we offer that, like, to somebody to have more time to sit down and talk to patients, right? Like there's the healthcare clinicians now are working very hard. And I think that they are getting through as many patients as they can, as quick as they can, because they have to, right? If you spend 10 minutes less with a patient, it gets more patients you get to see, right? And it's not that they don't want to spend time with those patients, they want to see more patients, so they're doing their best. And I think we have an opportunity starting off, right? If you're just starting off, you have an opportunity to spend more time with your patients. So I think we're excited about that role. So I'm kind of blabbering a little bit. I think I would say that in watching, I think a part of this, and I know Willie's kind of getting started in this, so maybe I'd look to him, but I think that's where we all go into medicine, right? Is to be able to spend as much time with your patients to kind of get back to our core, and I think we're hoping that this can kind of help us do that. So that's kind of why, but I don't know, what do you think?
All sounds good over here.
Yeah, I have a question. So, I have a natural person and they're in Utah since I previously lived in Utah, and they worked out of University of Utah, so it's Dr. Stanford and then Ashley Benson, and yeah, it's like she knows them. So they work within the university and they do a lot of telehealth stuff. Do you guys see yourselves in the future being absorbed? Do you see yourselves being absorbed into the university at some point? I can see the pros and cons with that, but I could also see like the teaching benefits of being available for students to be educated, because they're able to mentor a ton of students, and their practice has just absolutely exploded. Like their wait list is months long, like everyone wants to get in with them. So I don't know if you see yourselves kind of merging a little bit more with the University of Missouri, or?
One thing that I would say pretty strongly is, like you used the word being like swallowed by the university. No, we don't want that. And so that, like setting ourselves up as a 501c3 that's governed by a board of directors that has the bishop as the one appointing the board members, that is very conscious, intentionally done, because we want to maintain. We want to avoid sliding towards a secular model.
Yeah.
We want to maintain the standards that we are excited to start off this top. Now, at the same time, what Christina was just talking about, and what we've talked about a little bit earlier too, is we want to have a good working relationship with the university or Boone or any of the healthcare providers here, because we want to provide the best care for people. And so if someone else has the best care in this or that, or if, like I said earlier, if someone comes to us and says, you know, I want to use artificial contraceptions, for example, then we might say, well, you have to go to somewhere else to get that. We don't provide that here. And, you know, and you're free to do that. We wouldn't recommend that, but you're free to do that. But yeah, that's a good question about what kind of collaboration we could have, apart from just referrals, you know, back and forth.
I would add that, I think I'm obviously thinking of the academic side, right? I think it certainly could be an opportunity where we could have, would consider, like, do we take students, right? Do we take students, I don't know, a student or so at a time, a med student, a nursing student, whatever, right? I don't know. I think we would certainly talk about that and consider that. It would be outside, kind of a community health type of, obviously, because we would be in the med school, right? We're not in med school, so it would be a different setting. So I don't know. I think we'd have to consider that, kind of the pros and cons, right? Certainly our physicians have to be willing to teach that, physicians and nurses have to be willing to do that. But yeah, I think we certainly.
Yeah, I would envision, like, I was thinking about this as we were talking earlier, you know, when we start hiring, or just down the road as we hire more people or, you know, new hires, part of that would be, well, here's the mission for our center, and we need you to be able to be on board with that mission. You know, whether you personally believe something different, you know, we need you to be on board with the mission in your role here. And hopefully we want you to believe in the mission as well personally. So that would be a big thing. You know, I would feel uncomfortable hiring someone who really didn't accept our vision of healthcare, that kind of more holistic model that we've been talking about. So.
Like, kind of to add, I think, I mean, I know students who would be excited to get to do shadowing or learning in this kind of setting. Like, I think that's, like, probably for them, this couldn't get set up sooner, you know? They would be excited to get to do some of that.
Yeah, I've had a number of our, like, Newman parishioners who are nurses just say that, you know, as soon as we're open, they're willing to be hired. You know, so it's another way that people can support us, right? Come and apply and get hired. So.
I guess, like, along that line, do you all see pelvic floor therapy as, like, a part of the team someday?
You talked about that.
Yeah, we have talked about that, and I would say absolutely yes. We haven't really, pelvic floor therapy, have we thought about pelvic floor? Yeah, there's a huge need for that. I actually have a niece who is a brand new pelvic floor physical therapist, and I can't be more in awe of talking to her, listening to her. I'm like, oh, if they only had this when I had my babies. So, yeah, like, I think it's, there's a lot out there that I think we're just starting to touch on these services, and we kind of have some of the basic fundamental ones, but I think as a team, we certainly would want to talk about some of those, and that one, I think, feels really exciting and certainly beneficial to our patients.
And I apologize if this question's already been answered before, but what about telehealth? Are you guys gonna open up telehealth? Because I know there's some more, like, remote areas in Missouri, and like I said, like in Utah, that's my only access is literally over telehealth, and so I don't know if you guys have talked about that or open to that.
I don't think we haven't mentioned that specifically, but, you know, the question is about whether we'll have telehealth services or not. But, you know, we do really envision that this center would be servicing, like I said, a much larger area than Columbia, getting into the you know, very, very rural areas, which, you know, they're seeing their services go down in the rural areas. So people are having to come to more of the city, or to Columbia or to St. Louis or Kansas City. So I could see where telehealth could be helpful and important in that regard. So that'd be something for us to talk about.
we sort of perfected that during COVID, so, yeah, I think most, most positions and teams have that pretty mastered, yeah.
Please continue asking questions and responding. I have 8 p.m. mass downstairs, so I'm gonna turn it over to you. You can take my seat here, so that you're right this time.
Oh, yay.
Thank you.
I got the sense that questions were slowing down, so we're not offended.
Not at all. Any thoughts, questions for us? Sorry, I was late, had another meeting.
Well, thanks for coming. We enjoyed getting you the chance to speak about it, and if you have any other questions, at least you have a couple of faces now, but Father Dan and the committee would love to consider any of your ideas, so please reach out if you have something that comes to mind later. Anyway.
Thank you.
Thank you.